Hi, welcome to Chamber Chats. I'm Bruce Williams. I'm the CEO of the Greater Victoria Chamber of Commerce, therefore Chamber Chats. I would like to begin by acknowledging that I live and work in the ancestral territory of the Lekwungen-speaking nations. They are the Songhees and the Esquimalt, and it's our privilege and honor to live and work with them every day. Chamber Chats is made possible by the support of Island Savings, a division of First West Credit Union, and as always, we are recording today in the podcasting studios of Czech Television. At the very beginning of the pandemic, all those many months ago, I heard a number of people say that in the long run, the mental health impact of this pandemic would probably end up being greater than the economic impact. And I think we're starting to see evidence of that now, which is why our two guests are with us today. Jonny Morris is the CEO of the Canadian Mental Health Association, CMHA BC Division, and Aaryn Secker is here. She is the Director of Education and Training for CMHA in BC. Jonny, I'll start with you. Thanks for being with us.
Thanks for having me back, Bruce.
So the name is quite self-explanatory, Canadian Mental Health Association, but let's just remind people about the core function of the organization and what you do.
Yeah, we're one of the oldest, most established charitable organizations in this country. And here in BC, we strive to do things against three pillars, I'd say, Bruce. We have a whole role to play in training and education, and that's what Aaryn leads up, and you'll meet Aaryn in a few moments. Really equipping people with the skills and the knowledge to understand and manage mental health and well-being. We advocate, so we push for change. We advocate with government, with funders, with decision makers to make the changes we all want to see in the mental health system here in British Columbia. And we also have a whole range of direct services at the provincial office. We offer programs focused on depression, anxiety, and parenting. And we work in close partnership with 14 branches that are located across the province and throughout BC, serving local communities.
So thank goodness we've all come to a place in our culture that we can talk more about mental health challenges and the issues that are surrounding that. Aaryn, I'm going to come to you with this question. So pre-pandemic, let's say 2.5 years ago, what were the more prevalent things that CMHA was working with when clients got in touch with you?
I would say, we're talking about pre-pandemic with this question, but there's actually been some very common themes that have carried through into the pandemic. So, a lot of folks who we talk to experiencing levels of anxiety and worry, low mood and depression, challenges around substance use. I would say that those are some of the big ones that we would be talking about. And then with the pandemic, we're seeing just kind of higher rates of that, higher levels. And I'd say more folks who maybe didn't have mental health top of mind or weren't part of the conversation who are now entering into the conversation. So lots and lots of stress and worry and uncertainty right now.
So Aaryn, I'm going to stay with you for this. Without overstating the obvious, I would think that a lot of that has been driven by isolation. It's been driven by uncertainty. Is that what you're hearing from people now?
Yeah, definitely. Isolation and uncertainty, and a lot of the coping strategies we might have used before the pandemic aren't necessarily as accessible now. So a lot of that social connection that we would maybe lean into before the pandemic, now there's additional worries around that, around whether we can gather, whether we can travel, who we can gather with, the size of the groups, uncertainty around those times of year that maybe we could have counted on to bring us together, and now we don't necessarily know if we can do that. So yeah, definitely that loneliness, perceived loneliness and isolation, those are really big right now still.
How often do you hear the word fear?
We definitely hear fear a lot, but I would say, worry, stress, lonely, some of those kind of negative emotions tends to be how it comes out. And of course, folks feeling angry and irritable as well, who might not necessarily say it's fear, but we know that when we're listening to what's really driving those emotions, there's often fear at the core of that.
Yeah, our resilience has certainly been beat up, that's for sure. But as we get back in person with events right now, people are happy to be there and happy to see each other, but there is still some level of uncertainty, I know. Jonny, from an organizational point of view, what does the CMHA do to actually act on these concerns of people that contact the agency?
Well, we were one of the first organizations in the country to do polling research from the very beginning. And so we've actually been able to validate what Aaryn was just saying with some of the research we've collected and see some of the hardest hit groups of people who already live with a mental health or a substance use problem. Parents have been hard hit too. people living with a disability, and racialized folks, people of color. And so part of what we've been doing is really studying and understanding so that we can target our efforts. And so we, in partnership with partners and allies and our branch community, have really tried to step up resources right from the very beginning. One of the first things out of the gate through BC division was operating a service for healthcare workers. We were very grateful to receive some investments from the province early on to stand up virtual mental health care for folks working in long-term care facilities and community health, folks who do home care aid work. Because as we can all remember, in those early days of the pandemic, those communities, healthcare workers, been particularly hard hit. And that service has run through the pandemic. It's still operational. We actually have a group of healthcare workers who've lived experience of being a healthcare worker, providing peer support over the phone and through chat throughout the week for folks working in that space. And we hope to see that continue. So we were really quick to mobilize, and we're continuing to do that as recently of this past week, working with our partners like the Red Cross and ministries around the mental health impacts of floods, which of course is profound. And we might get to that later in the interview.
Right.
We also, Bruce, have a stable of resources that we've always offered. So Bounce Back is a free program that's available across the province. A number of our branches operate it. And it's for people who experience worry, stress, low mood, depression. And it's a people-powered, a human-powered coaching program for people who want to learn more skills around managing their thoughts, their feelings, and their behavior. Again, just to help have a bit more control in their life. It's not going to fix climate change or the pandemic, but it can help people experience more room to maneuver in their lives when it comes to managing the distress that's around us. So we've been trying to make our programs more accessible, and we've been profiling the work of our partners. I think of the BC Crisis Line Network, who have over 700 volunteers, 24/7, millions of minutes of volunteer crisis line care that's available through 310-6789. We've been trying to stand up and support that incredibly essential work.
Yeah, that's a phone number, 310-6789, by the way. So that's something to know. So Aaryn, Jonny mentioned about healthcare workers. They kind of have the situation with them is compounded by their own private lives and the external effects that this whole thing has had on them. Then they go into work, and then they get it from the other direction because they're care providers to the people that are dealing with the healthcare that they need right now. Can you talk a little bit about that and what you've heard?
Yeah, absolutely. So, I think a lot of us are maybe just not at our best right now. And so, sometimes we either take that out on the folks who care about this the most, or the folks who are there to help us. And that just compounds, again, that uncertainty. Those are complex feelings and thoughts to have those difficult interactions with the people you're caring for. And again, I think understanding that folks are, they're worried about their loved ones as well. They're worried about care, and they're worried about what they're hearing or not hearing in messaging. And so, definitely it can come to a bit of a boiling point or a bubbling point in some of these interactions. So definitely extra concerns around conflict, timely communication. Those are definitely some of the challenges that we're hearing right now. That being said, too, I just want to note, though, that, most people are very understanding right now. We are hearing a lot about resilience. We're hearing a lot about people really stepping up and supporting one another. So I just want to highlight those stories as well that we are hearing. So there's definitely conflict in those challenges, but also really excellent examples of people who are relying on care, family who are relying on caregivers, who are really stepping up and offering that support and showing that they do appreciate what people in community health and long-term care are doing.
Yeah, I mean, agencies like CMHA are there to help, but yes, friends and family are there to support too. I mean, on top of the pandemic, we just referred to this a short time ago, we'll continue on with it next. That's the impact that suddenly climate is in the picture. We're going to talk about that next. We're talking today on Chamber Chats with Jonny Morris. He is the CEO of the Canadian Mental Health Association BC Division, and Aaryn Secker is Director of Education and Training for CMHA BC. So, the heat dome in the summer, the atmospheric river came along. Jonny, what kind of a spike did CMHC see when that suddenly manifested, especially the atmospheric river that happened just a short time ago?
We've definitely heard it directly from our partners. I think of the BC Crisis Line Network, who have reported double-digit increases in the number of calls received as folks have tried to, again, process, seek support around these big events happening in and around us. I mean, as you know, Bruce, tragically, the province saw a huge loss of life during that heat dome, and with that, all of the bereavement and loss that comes with losing lives related to that climate change related impact. So definitely people reaching out for support. And I think most recently, we've been working with partners like the BC Crisis Line Network, the province, a fantastic organization called AgSafe, who do a lot of care and support for the agricultural community, and also the Red Cross and some folks in the ministry who do health emergency management. And we've been trying to really mobilize and coordinate resources so that if you're looking for emotional help, you know where to go. You're not fussing with 22 phone numbers, you know where to go. And at the same time, if you're looking for practical help, like how do I get back to my flooded property? I mean, that's been a big piece, recently around people returning to their homes, whether it be the Lytton fire earlier this summer or Merritt, which was flooded a few weeks ago. So, we've been trying to really coordinate so that there's no wrong door. There's always a right door for folks who are currently have been grappling with massive disruptive events, right? And I think we've seen that with some of these climate-related weather events recently. Folks trying to manage, folks who are experiencing grief and concern, worry, isolation, a loss of identity, right? For folks, who've perhaps lost livelihood or are worried about losing their livelihood, they are reaching out and seeking support. And I think that's something we've noticed here at CMHA too, with upticks in accessing our programs. We've heard, parents of kids who are asking, what's going on in the world? What's happening on television? What's happening here in the place I live? Young people, I know Aaryn has lots to say about that too, around young people who are processing what's happening related to climate change, and of course wanting to take action to help create a better future for all of us when it comes to the world we live in.
Yeah, and you talk about how kids interpret that and they look to their parents and their friends for an explanation on that. And Aaryn, when we go back and talk about the flood damage that happened and the heat damage. On the island, we were spared a lot of that. We did have some challenges, but we, again, just by being adjacent to those parts of the province where that happened, we can get this sense of vulnerability and helplessness that seems to come along with that. And granted, yes, we can all play a part in mitigating climate change, which we all know we have to start doing a lot faster now. But Aaryn, how do you practically deal with that when someone says, I feel absolutely helpless, I feel vulnerable?
Yeah, I think with folks of any age, it's really important that we validate those emotions, right? Those are really understandable emotions to have right now. So the last thing we want to do is to be dismissive, or sometimes we try to paint a silver lining around things. We try to say, well, on the other hand, or we try to be very assuring to the point where maybe we're not realistic, like that would never happen here, or that will never happen to us. And I'd encourage folks to maybe try not to go down that route as much as possible, and instead to validate what you're hearing, to acknowledge that those are very understandable emotions, to just even hold a space for them, to talk about them and have these frank discussions or candid discussions. And I know we're not just talking about young people and parents anymore, but really like in those family relationships and dynamics, whether that's coworker to coworker, coworkers to managers, whatever the dynamic is, to really just hold a space for those challenging feelings that we're having. And then often to then kind of move from this space of holding them and acknowledging them to what do I have control over in my life? So what are some of the actions that I can take, whether that's around my self-care and self-management, but also maybe around those bigger advocacy pieces, or reaching out and supporting those who do need help right now. And knowing that, yes, we might be in a different position in the future, but if I'm in a position to help now, that's something I can do and a difference that I can make. And in that is often a very empowering feeling too.
It's a very flippant remark that people have made for a long time, saying, well, I'll just go to my happy place. I'll be fine. I will just go to my happy place. How do you find that door? How do you find that road, Aaryn? What's involved with that?
Well, and some folks are very good at kind of reframing what's happening in their life, and I think that's a very healthy coping strategy in some cases. But we have to balance that, right, and use different strategies depending on the situation that we're faced with. So we definitely don't want to just put our head in the sand and pretend that nothing is happening, because that's not going to move us forward either, and that's not going to be very supportive to those who maybe are looking to us for some strength as well. So we definitely don't want to go to our happy place to the point where we're pushing out what is happening or pushing down our emotions or not acknowledging them. But, again, sometimes we can reframe, or we can find those positive aspects in our life, that gratitude in our own life. That's a fantastic thing to be able to do. But yeah, to sit with it and to process it, in my mind, is a little bit different than just trying to avoid or kind of get away from what you're experiencing.
Yeah. Next, I want to go back and talk about what we should be saying to young people. On Chamber Chats today, we're talking with Jonny Morris, who is the CEO of the Canadian Mental Health Association BC Division, and Aaryn Secker is the Director of Education and Training for CMHA BC. So Aaryn, I'm going to come back and start with you here. What can people think about saying to their children or younger people that they work with when they express all of the frustrations and the anger and the helplessness? What can we do to offer perspective to younger people who may not have lived this kind of tragedy before?
Yeah, so I think it can be very helpful to be a little bit vulnerable, to share what experiences you've had and when you've gotten through tough times. I know a strategy that's often helpful is to kind of talk through your own stress response or talk through your own action plans. So, if you are a parent, saying, this is how I manage, or these are the things that are worrying me and what I'm doing about it. So talking through that kind of emotional regulation to help role model that. But then also not feeling like you need to have all the answers. And I think that can be really tough when you are talking to a young person or someone you care about. Again, you want to kind of offer that strength and make it seem like you have everything figured out. But we're talking about something as big as climate change. We might have been through tough experiences ourselves, but I think it's fair to say most of us haven't been through something quite this big or this uncertain. And I think that's fair to acknowledge and to say, we're going to figure this out together, or what can we do together to cope with these feelings and to feel like we are making a difference. So I would really encourage a collaborative approach where possible. Also bringing in, your child's or the young person's other support networks too. So what are their teachers saying? What are the other adults in their life saying? What are they talking about as a group and friends? What are those other strategies that are being used? And really trying to kind of amplify or align with those, and really lean on the rest of the support network around too. And then, of course, if you are in that caregiving relationship or a parent relationship, making sure you're getting help for yourself too. So, you're supporting a young person, and then who actually supports you. So making sure that you're reaching out and you're getting help as you need it as well.
As we've said before, a number of different times on this podcast and elsewhere, it doesn't show a sign of weakness to reach out and ask for help if you're having trouble with your mental health. It's actually the opposite. It shows how strong you are to reach out and ask for that help, so you can be all you can be for yourself and for others too. Jonny, healthcare is an essential service in this province. We're increasingly more seeing how important mental health care is. Who's paying for all this, especially what your organization does?
Well, it's a great question. I would say there's a few different payers. I think here in Canada and in BC, we do have a mixture. We have private sector contributions to mental health. I mean, if you're an employee in an organization, you've got a benefits plan, that's a private sector piece. Not everyone has that. For us, we're very grateful for a significant amount of our money coming from the province of British Columbia here, and also donations. When we last connected, we had the United Way of Southern Vancouver Island, who've been a big part of a fundraising campaign focused on mental health, and we benefited from some of those dollars as well. So, I think when you think about the state of mental health care, community organizations often rely upon bits of money from the government, bits of money from the health authority, and also the generosity of donors, people giving in them. And there are many donors who support this organization, like Centra Windows, for example, Noodlebox, Mod Pizza. There's a few folks who I think are probably, very local to Victoria who care deeply about mental health and help us carry out our mission by that that generous set of gifts. But some of these bigger items like bounce back all the healthcare workers, the province has really leaned into some of that. And I think earlier this year we saw the province announce a $500 million investment in mental health and substance use care. That's a remarkable and important contribution to what's required. And often I think about funding in the mental health care system as, if you think about a vintage car that's been in the garage for 30 or 40 years and really hasn't had any oil put in it or gasoline, and you take that car out and expect to go on a drive, there's a lot of work. And I think that work is gradually starting to take hold. But we absolutely have so much more to do in getting that car roadworthy, when it comes to people's experience in the emergency department, or people being able to get the right care at the right time. It's going to take more of those kinds of investments and concerted effort to really put mental health care on the same footing as physical healthcare, though that's been really hard hit through the pandemic right now as well. The whole healthcare system, as you say, Bruce, is under very real strain right now.
Just about time to wrap this up here. I want to talk about triggers, though, and Aaryn, I'm going to go to you for this. So there was a recent television series called Made that got a lot of attention because it was shot in and around Victoria. I have heard an unfortunate number of people, though, say that they couldn't finish watching that because the triggers were there that reminded them of, unfortunately, assault, abuse, poverty in their own past. We have to be pretty careful about what we're consuming, right, to kill all this time that we have on our hands. What do you hear about that kind of stuff?
Yeah, and it's a really difficult line to walk, I think, for media producers, because on the one hand, you don't want to gloss over or sugarcoat the experiences of individuals who, have a rough time, whether that's in their jobs or their life. So you definitely want to have, accurate and fair depictions of someone's experience, so you're not trivializing it. So something can be accurate and very worthwhile in watching, but you might decide it's not for me right now, or it's not just not for me by myself. So if we're talking about TV and movies, that's one thing. You can often give yourself a little bit more preparation or decide if you want to partake or not. But when it comes to news and social media, we're often just really bombarded with all sorts of very difficult topics. And of course, it's really good to be informed. We want folks to be informed, but sometimes we need to know when to take a break. And then just being very conscientious about what we are consuming. So do I really need this right now? Is this really the platform for me or the venue for me? And just making those conscious decisions.
Right. Here are some links on screen to a workplace hub and to some seminars you can access if you want to find out more about this for your family and co-workers. And also the website for the Canadian Mental Health Association in BC is cmha.bc.ca. Jonny Morris, CEO of CMHA BC, and Aaryn Secker, Director of Education and Training, thanks very much for your time today.
Thanks so much, Bruce.
And that's Chamber Chats for this time around. We'll see you again.